He's had a rather good day today. Not only did he get to announce the end of the teachers' strike that's been going on in England, much to the frustration of many households. It looks like the teachers are probably, it's the expectation of the union leadership, going to accept that dispute is over. He got also to announce that he was going to fund it without borrowing and be very virtuous as he sees it. And he feels, you suspect, that he's raising the money in ways that voters might not be very cross about. The two particular cash raises that he pointed at were additional charges on migrants from abroad coming to this country to work. But the junior doctors clearly are unimpressed by the pay award that he's offered to them. They have the capacity to knock his pledge, reducing hospital waiting times, off course. Public sector pay review bodies were saying there was an enormous problem with retention in the public sector, and you kind of feel, some people say, maybe the government was going to have to accept these offers anyway, and maybe should have done it sooner. And this may leave some people in the public sector, maybe even elsewhere, thinking strikes work.
What do we want? Survey! When do we want it? Now!
Junior doctors beginning their unprecedented 5 days of strike action today, unimpressed by the government's pay offer, way short of their demands. But for the teachers' unions in England, the government's pay award for this year looks like it'll end strike action that's been underway since February. Union leaders even let Rishi Sunak announce that.
They're suspending all planned strikes immediately. Teachers will return to the classroom. Disruption to our children's education will end.
We take that as a compliment, really, that the Prime Minister wanted to announce the deal with us. I think that's a testimony to the strength of the National Education Union.
As well as the teachers' pay award of 6.5%, junior doctors are being given a 6% pay increase, plus a one-off payment of £1,200. Police and prison officers are awarded 7%, and the armed forces between 5 to 6%. English junior doctors' leaders said their action would continue. Rishi Sunak warned it wouldn't get them any more money.
Now that we've honoured the independent pay recommendations, I implore you, do the right thing and know when to say yes. Today's offer is final. There will be no more talks on pay. We will not negotiate again on this year's settlements, and no amount of strikes will change our decision.
Well, you know, he might be accepting it, but I'm pretty sure that our members will not. Unfortunately, this is yet another sub-inflationary pay rise for most doctors.
The government said most of the NHS rises would be funded by the immigration health surcharge paid by visa applicants, going up from £600 to over £1,000, a 66% increase. Police and prison officer pay will in part be met by hikes of 15 to 20% in visa application costs. More money would come from letting departments keep underspends and switch them to covering pay, and from mostly unspecified efficiencies.
We are asking governments, departments to reprioritise to support public sector workers, and that will mean in other areas we will be, it's not about cuts, it's just about focusing on public sector workers' pay rather than other things.
Reprioritising means giving more money to some things and less money to other things. So the things you're giving less money to are clearly being cut.
The government insists it won't mean cuts to frontline services. Some in schools said that promise must be stuck to.
The devil is in the detail, so they're saying they will look at workload, that's been said before. They're saying they're going to cover the pay deal because in our school budgets we don't have enough to cover this amount of money. So will what they're promising us actually cover what we have to pay out to teachers? That's going to be the issue for us as heads.
Rishi Sunak said the government deserved credit for backing independent pay review bodies, but the teachers' union said he'd threatened to ignore them.
They made it very clear to us that, you know, if we didn't settle, then we would lose this award. And, you know, the question that we had to ask ourselves is, even if we had really intensive action, 20 days or so during the autumn term, would that move this government? And we came to the conclusion that we probably thought that was unlikely.
Continuing strike action by junior doctors threatens to knock Rishi Sunak's pledge to cut hospital waiting lists off course. The Prime Minister said his inflation pledge won't be affected by today's pay awards because he wasn't borrowing new cash to meet them.
Gary Gibbon reporting there. Well, joining me now from Manchester is Dr Vivek Trivedi. He's the co-chair of the British Medical Association's Junior Doctors Committee. Matthew Taylor, Chief Executive of the NHS Confederation, which represents health service employers. He is in York. And with me is Anita Smith, a teacher at a secondary school in North Leeds. Thanks to all of you. First to you, Anita Smith. 6.5%. It is not going to outpace inflation by any means. A good offer or just the best one you're going to get?
I think at this stage it's probably the best one we're going to get, and I think teachers, certainly my colleagues I've spoken to today, welcome what we see as an end to what's been a very difficult year. We don't want to strike, we don't want to be out of the classroom, but we, as we do with everything, we think of funding to schools and workload for teachers and all of those things, and it's become impossible. So we wanted to be recognised that we need more money injected into schools.
So you think most people will accept it and the strikes will be over?
Personally, I hope so. Nobody wants to strike. It's hard, you know. Cost of living. Nobody wants to lose money. You know, teachers so far have lost 8 days' worth of pay and pension contributions. It's hard to do that. It's hard to convince people that we want you to come out and strike with us.
I mean, for schools also today, the PM promised that there will be extra money. It won't come out of existing budgets. I mean, is that too good to be true?
It sounds too good to be true, doesn't it? Which I suspect means it's too good to be true, sadly. There seems to be a bit of a hole. They've budgeted, we're told, for 3.5% increase, but an uplift of 6.5%. I mean, I'm no mathematician, but it looks like there's a bit of a gap there that needs filling. And we know that they're going to have to make cuts. They've been told the Department of Education has got to make cuts. And that means for schools like the one I teach in, that where's that money going to be taken from?
We'll hope to come back to that if we get time. Dr Vivek Trivedi, it's good enough for teachers. Why isn't it good enough for junior doctors?
Doctors like myself and the ones that I represent have lost more than 31% of our pay in real terms over the last 15 years. So an offer of 6% just doesn't go anywhere near enough to reverse the moral injury that this pay erosion has had on my colleagues. And if Mr Sunak thinks this offer will lead to doctors feeling valued when it's yet another real terms pay cut in itself and will stop doctors from leaving, then he is out of touch with reality, I'm afraid.
So it is interesting because what happens now? He was really blunt today. Final offer, no more talking. What do you do now? Do you keep striking indefinitely, letting waiting lists rise ever more, with no prospect of getting anywhere at all?
Isn't it a shame that Mr Sunak is, asking us to do the right thing when all we've wanted from his government is to have an open and honest and reasonable conversation? If we were afforded that in the first place, we would have never had to strike to begin with. But it was only because they ignored us that we striked in the first place. So if they continue to ignore us or ignore us again, as Mr Sunak suggests, then we will, of course, be calling for further strike action, ultimately to put pressure on him and his government, but only to come to the table, to have a conversation,
but he is
to be able to provide a credible offer.
Sorry to cut across you. He is saying very, very clearly today there will be no more talks. This is it. The strike should end. Do you think he's basically hoping for the best here? He's not quite telling the truth. He will come to the table if you keep striking.
It wouldn't be the first U-turn that he's made.
Matthew Taylor, doctors clearly not minded to accept this offer. Even if they did, can the NHS afford it?
Well, it doesn't look to us at first glance as though what's been identified by the Prime Minister and the Chancellor as the money that will be available to pay for the gap between this offer and what's in the budget will be adequate. And I think it's really important to understand the context in which this is taking place. So, in the NHS, we have something called the planning round, where trusts and systems agree their targets for the year ahead, targets in terms of improving efficiency and in terms of performance in areas like waiting lists. And I think every leader in the health service will tell you that that planning round was really tough this year, and that they have set targets which are, many of them will say to me, 105% level of the level they think is realistic. So we are already in a situation where it's very, very hard for us to meet our financial and performance targets. There simply is no fat on the bone. So we'll be interrogating the figures very carefully, because if more money is taken out of the health service, it will have an impact on services.
And in simple terms, if you can, what would that mean? At the moment, if you were forced to fund this pay offer, what would it mean day to day for the health service?
Well, it would mean what the Prime Minister calls reprioritisation. And what that means is there are things that we won't be able to do. And in a sense, you get an insight into that. You know, today is the first day of a 5-day junior doctors' strike. We have maintained accident and emergency. We will continue to undertake urgent operations, for example, for people with cancer patients. But in many, many hospitals, they've had to stop elective care, elective operations and outpatient appointments, which means that more people will join those waiting lists that it's been announced have got even longer today. So patient services will be jeopardised. And actually, you know, as you said in the report, the Prime Minister's own waiting list pledge will be jeopardised.
Dr. Trivedi, I mean, given all of that, given what is deemed by many to be the parlour state of the NHS already with waiting lists, what will be your next course of action?
Our next course of action will be, we remain open now to enter back into negotiations. We can use this suggestion and an offer from the DDRB as a basis to further negotiations. And if we're met with a government who treat us reasonably, who are able to work towards a credible offer, then we don't need to call for any further strike action. But it's important to note that actually during our previous set of negotiations in May, the government had sight of this DDRB report. They knew what the supposedly independent pay review body wanted to recommend, but still refused to offer us anything more than 5%, which is less than what this DDRB report suggested.
Very briefly, Anita Smith, the government has said this is about reprioritisation. If the money goes to public sector workers, it has to come out elsewhere. Across the board, do you anticipate cuts to services?
Of course, yeah. I mean, we can't magic money out of nowhere. So there will be. The reprioritisation in schools will mean that there'll be cuts to staffing, bigger class sizes, and parents will really start to notice that if they haven't already.
Anita Smith, Dr. Vivek Trivedi, Matthew Taylor, thank you so much for joining us.